So what we sought to do was understand the scope of these cell therapy clinics that are available to patients right now, and they're doing direct-to-consumer marketing. And so, as you probably know, there's no FDA-approved cell therapies for retinal disease at this point. However, patients have access to them through these clinics. And unfortunately, there have been some patients who've developed blinding complications after treatments at these clinics. And so we know that this is a big problem, and we wanted to try to better characterize the scope of these websites that are advertising to patients. What we did was a very detailed web search to analyze all these sites, and we found that there's over 70 different sites run by 40 companies that are actually offering eye treatments for different ophthalmological diseases. And so we found that they vary a lot in terms of what they offer treatments for. The most common disease that they target is macular degeneration. However, you can see a huge list of potential diseases that they target. They have a wide variety of cells that they use, but the most common ones are autologous fat-derived stem cells. And we also found that there's a range in the way that these treatments are delivered. The most common treatment delivery route that was advertised at these websites was intravenous. However, of the eye-specific ones, it included intravitreal injections or intraocular injections were the most common that we found. I think the biggest part is to try to get this message out. And so now that we know how much of a problem this is, it helps when our patients ask us about these specific clinics and these advertisements to give them certain key messages about what to try to avoid. And so what I always tell patients who ask is that they should certainly avoid places where the only treatment that's offered at that specific clinic is cell therapy, because we know that there are some legitimate cell therapy studies that are going on right now, and they can be done at universities or even at private practices. But those private practices and the university offer other treatments, like general retinal treatments, like intravitreal injections of anti-VEGF, and observation sometimes, because that is potentially the only treatment that's available or option that's available at this time. But when there's a company or a clinic that's only offering these cell therapies, that's a warning sign. The other big warning sign is being asked to pay for the treatments. And so right now, since it's not FDA approved, the studies that are going on right now are funded and cover the cost for the patients. And so if you're asked to pay out of pocket, that's a big red flag that you might be at one of these cell therapy clinics.